The Honourable Ruth Dyson.
Mr Speaker, my question is to the Minister of Health. Does he stand by all his recent statements on health services?
The Honourable Tony Ryle.
Mr Speaker, yes, including the statement that the issues the member raises are clearly not the result of this government reducing funding in health, because we've provided the district health boards with $536 million extra funding this year. One of the major reasons for individual DHBs looking carefully at their service priorities is because the last government set them on a track to delivering towards $200 million of unfunded services, and we are endeavouring to fill that gap.
Order. The Minister shouldn't go on too long in that vein. He was just asked whether he stood by a statement. The Honourable Ruth Dyson.
Supplementary. Given the $536 million extra dollars in the health budget, what does he say to Age Concern Elder Abuse Coordinator?
Order.
Mr.
Order. I've called the Honourable Ruth Dyson and her question should be heard.
What does he say to Age Concern Elder Abuse
Order. I apologise, the Honourable Ruth Dyson, but there's so much noise I cannot hear a question. That's unreasonable. Now I say to all members on my feet, they must not interject. The Honourable Ruth Dyson.
What does he say to Age Concern Elder Abuse Coordinator Jenny Mitchell from Auckland's North Shore, who says that more elderly people who are trying to live safely in their own homes are now being denied Meals on Wheels help in an effort to save his health budget $5.13 per person per day?
The Honourable Tony Ryle.
Mr Speaker, if that member if those facts are correct and the member wants to make that information available to me, I will look into the case. But what I will tell those members opposite is that we are putting more money into the health services and more New Zealanders are getting better frontline services.
The Honourable Ruth Dyson.
With 3,000 elderly and frail people in the Southern District Health Board, 1,500 in Canterbury and hundreds in Kapiti having their home support cut or reduced, Horowhenua proposing to close their rehab beds for older people, eye surgery at Nelson Hospital being reduced, how many more cuts in health services for the elderly can be expected over the coming few months?
The Honourable Tony Ryle.
First of all, those numbers the member quotes are quite incorrect.
Speaker.
Point of order, the Honourable Ruth Dyson.
The Minister's implying that I am misleading the House, and I take exception to...
The member will resume her seat immediately. Oh, no. The member inserted a string of what she claims was fact into her question. The Minister has disputed those figures, and the Minister's perfectly at liberty to do that. He's not saying that she's misleading the House. He's just saying that his figures don't agree with the members, and he's perfectly at liberty to do that. The Honourable Tony Ryle.
Point of order, Mr Speaker. The member made another unparliamentary comment, the same as she made last time the House sat, and she should apologise for that.
I must...
Apologise.
What's all this melodrama about?
The Honourable Tony Ryle.
Mr Speaker, I'd say to those members to remember the history, that under that member's government, they stopped the home support cleaning for 700 people in Otago, Southland. Ruth Dyson was the Minister for Disabilities when they cut home cleaning for 300 people in Wanganui, and she never said a word.
Dr. Paul Hutchison.
Thank you, Mr Speaker. To the Minister of Health.
Order. Dr. Paul Hutchison.
Thank you, Mr Speaker. What reports has he received on improving frontline services?
Honourable Tony Ryle.
Mr Speaker, I've received reports indicating improved frontline services at the county's Manukau DHB in South Auckland. Last year they delivered a record 15,200 elective surgeries, an increase of 14%. They did almost 3,000 surgical first specialist assessments, an increase of around 10%. The emergency department there is seeing more people faster. It's seeing around 90,000 patients a year, and they are meeting the new government's 6-hour maximum waiting target. Around 7,000 patients attended a nurse-led clinic, a 16% increase on the previous year. If members want to know where the additional money in health is going, it is going into improved frontline services in priority areas that the party opposite neglected for years.
The Honourable Ruth Dyson.
Why did he allow the 198 Youth Health Centre to close last Friday after assuring the public of New Zealand that it would give continued services to young people in Canterbury?
The Honourable Tony Ryle.
Mr Speaker, I'm advised that the Waipuna Trust has been contracted to provide mental health and alcohol and other drug services for young people for 6 months. They have employed the staff from 198 and clients have transferred across. An existing local practice has accepted 198 patients, records are transferred, but youth can choose elsewhere. Youth sexual health services are available free at all practices across the city, and the funding previously used in 198 is supporting these new arrangements of frontline services in Christchurch.
Question number 9, Jonathan Young.
Thank you, Mr Speaker. My question